My name's Adam Gardner. I'm a flight nurse with Lehigh Valley Medevac on the critical care transport team. I'm going to be going over donning and doffing today of PPE. So the PPE that we're going to be wearing for a COVID patient is going to be a gown, mask, gloves, and goggles. The first step for putting the PPE on is going to be to put your gown on. When you're putting your gown on, you should ensure that you secure it properly so that it's wrapped all the way around you and not opened up and hanging on the side or having the risk of coming undone. You can get somebody to help you if you need to, but just make sure that it's fully tied and protecting you all around. The next step is going to be to put on your mask. For this process, we're going to put on an N95 first, and then we're going to cover it with a surgical mask so that we can use the N95 multiple times and not be wasting the PPE that we have. To put it on, you cover your nose and go over top and do it that way. Make sure that the metal is around your neck, your nose, and that you have a good seal with the mask. You're then going to put on the surgical mask over top. And this will help to keep the N95 clean so that you can reuse it again. Next, we're going to put on eye protection. It can be safety glasses that are used, or it can be a face shield if that is all you have access to. The gloves will go on next. When you put the gloves on, make sure that they're going over the cuff of the gown so that you're fully covered and your wrist is not exposed. If you have gloves that have a longer cuff, that's another good option, but if you just have regular short gloves, these will be fine as well. And now you're ready to take care of the COVID patient. Alright, for the doffing of the PPE, there's going to be a lot of hand sanitizer which is used during multiple steps throughout the procedure. The first step for doffing is to sanitize your hands. You can use any alcohol-based hand sanitizer that you have, and just make sure that you rub it in well and clean off your gloves since you've had them on when taking care of a patient. Once that is complete, you're going to take your gown and gloves off. The best way to take the gown off is to grab it by the shoulders. If it's a disposable gown like this, you can just pull it away from you so that it rips the Velcro in the back as well as the strings that are tied in the back. You pull it away from you, make sure that you're holding on to the outside of the gown and just continue to keep it away from you. If you bend over a little bit, you can ensure that it's not going to be coming up and contact your body with the contaminated side. It'll be rolled into itself, making sure that you're holding on to the gown so it doesn't come up in contact with you again. And then you can dispose of it into a trash can. You're then going to take your gloves and you're going to sanitize them one more time. At this point, you can take the gloves off, make sure that you use the proper procedure to grab it on the inside, which is contaminated with the other side of your glove that's contaminated. Take them off that way. Put them inside each other so you don't have any contaminated sides sticking out, and you can dispose of those as well. You're going to sanitize your hands again with the alcohol sanitizer. And now you're going to remove your face shield or your goggles. Those can be wiped down later so that you can reuse them and use them for multiple patients and multiple days. You're going to sanitize your hands again. And like I said, the sanitizing occurs between each step of the process. And now you're going to be removing your mask. So the surgical mask is the contaminated one since it's on the outside. You grab it from behind the ears, take it off, and dispose of that as well. You're going to sanitize your hands one more time just in case you came in contact with the soiled mask. And you're going to take off the N95. To take off the N95, grab the bottom strap first and take it over the top. You want to make sure you grab the bottom one first, because if you grab the top, it has the risk of falling down onto your chest and contaminating there. Even though the front was covered with the surgical mask, you just want to do it just to be sure in case any contamination occurred on the mask. You can then take the top off and you can dispose of that mask. Now you'll sanitize your hands one more time, and then you're complete with the doffing process. Please keep these steps in mind when you're taking care of a COVID patient. If you can keep the checklist with you, make sure that your partner's doing it properly as well. You can read it off to each other if you need to, but it's very important that you follow these steps to prevent the spread of COVID and ensure that you and your partner remain safe and you don't take it home to your family.